This podcast intro, songs AI. It's on YouTube and Spotify. You can use your ears or use your eyes. It's 30 minutes randomized.
Hey everybody, welcome back to another episode of 30 Minutes Randomized. I'm your host, Steve Wimmer, and I am joined today by a bigwig, someone with CEO in his title, Joel Morse of Curavit. Joel, how's it going?
It's going great, Steve. Thanks for having me.
Yeah, absolutely. It's a pleasure. You're one of the industry people I have known maybe among the longest. Our relationship dates back, I think, all the way to 2020, if not 2019, which is exciting. If you could just share a little bit about, I think everybody understands the title of CEO, but what is Curavit up to? What are you guys doing so they understand kind of where your answers are coming from?
Well, thanks. So Curavit is a specialty CRO founded with the mission of bringing innovation to clinical trials. And we have a heavier lean towards direct to participant and hybrid clinical trials.
Okay, awesome. So CRO, doing some niche stuff, doing technology stuff. Great. I love it. If you're just tuning in for the first time, we are going to spin a wheel that has all the questions on it. We may not get to all of them, but the conversation will be directed by random chance. First question, locked and loaded. All right, we're going to start with a spicy one. What is a number that CROs would hate reporting publicly if they were forced to?
Well, that's a tough question. You know, CROs actually, I think, are very open with their data, and that's their culture because they're always audited. You know, the data has to be validated, et cetera. But they would probably be most frustrated with things that they don't control. And one thing that is not controlled, and Stevie, you know this well, is patient recruitment timelines. And so CROs during the bidding process will talk a lot about their site network and how those sites have a lot of patients and they believe that they can get X, and let's call it, and X is a number of months during the proposal process, and then let's call it Y, the actual number of months. And if they had to report that, that would be a challenge. And I think maybe not fair because ultimately it's very hard for CROs to manage sites and get the right numbers of participants in the time that everybody says they will. But I think we could probably all do a better job being realistic about that. And the trouble is the sponsor needs to, I think, be part of that because they might go with the CRO that gives them the answer they want versus the right answer. So
yeah, I mean, we could probably have a whole conversation around realism in projections and then the projections that win you the award. And that's it's a tough scene that those are different numbers, but I think it's also, that would be a wild number if every CRO just had that on a dashboard, like when you went to their website, the average delta between their quoted time and actual. But like you said, there's so many people involved. It's really tough to say a single stakeholder is accountable to recruitment, and maybe that's part of the problem that causes it to be such a challenge over the years. All right, I appreciate that answer, and I think we're good to go to move on to the next question. I'm going to hit the spinny wheel and we'll see what is in store. All right. So you don't have to read this. I'll read it to you. I just have it there for me. So I know that you guys used to work with dedicated recruitment providers. There was some like outsourcing of that function. And over time you brought it in-house and now you guys are doing that yourselves for your own trial. And I don't know if that's 100%, but I think across the board, like you guys are managing your recruitment efforts internally. What did you learn from outsourcing recruitment that kind of made you decide as a company that you needed to own that function for the most part?
Yeah, so when we're talking about this type of recruiting, it's all digital recruiting. So Curavit runs site-based trials where the site is responsible for the recruiting. Obviously, we engage and help, and then we run hybrid or decentralized trials where we are taking on the burden or the opportunity to do the recruiting. And so that's what you're referring to here. And then what we were doing was outsourcing what I would call the activity to get people to the top of the funnel. So building awareness in the digital world about trials, the call to action to be a link to the top of a website, screening website, and then we would take it from there to go through the screening. And so what we learned is that you need a tremendous amount of expertise and what we call, intellectual property, IP, on that screening process, because we don't start with a medical record. And depending on the protocol, there's a number of steps that you need to validate in order to have a participant being approved and right for each trial. And so that's where we built up a lot of, or we built a tremendous amount of expertise internally. And we learned that we really needed to own that process. Our recruiting partners, who we all thought very highly of, did two things. Well, one thing for us, and then I think strategically they're trying to expand their services. So the thing that they did for us was build those ads, the ad package, the IRB ad package, effectively place them in the digital ecosystem to optimize our cost per click and to get the right people to the top of the funnel. But then, as it seemed like from our perspective, as those companies wanted to increase their value, and especially most of the activity for those companies is the value of the linkage of the person to the participant to the physical site in that handoff. And they were taking on more and more responsibility for the technology platform that helps enable that. And that overlapped with what we were doing. And so that was a situation where the strategy of a lot of the outsourcers conflicted with what we were trying to do. And then what we also learned was that Metas and the TikToks of the world, they have a lot of IP about putting the right ad in front of the right person. And then probably what tipped it to us to take it in-house was AI to actually build the ads very quickly, very efficiently. And so what we found was we were the lift to actually do the ads and place the ads in the right place in the ecosystem. A lot of that was really taken over by AI and the digital platforms like Meta. And that enabled us to take that over. And we were already building that tech ecosystem for the screening. And so that's why it just made sense for us to take it over.
Yeah, I think you've hit on something that I sense a general consensus forming in the industry, and that is getting people to kind of raise hands and enter the very top of that consideration funnel. You can be good at that, or extremely good, or mediocre, but it's hard to be really bad at that. Like that.
It's a good way to think about it. Yeah.
That step is the easiest step in the process. It's not necessarily easy, but it's the easiest part of it. And that middle, that connector of, sorting through the medical records, or is a person eligible, qualifying their interest, making the connection, whether to a digital platform for a fully DCT or at the site level, that is hard. And you're building up that process. And I think you're right. A lot of the companies that are running centralized recruitment efforts are trying to rent you that process. They're also very good at it, but they're the ones who retain all the ownership of the technology and the steps and all that thing. So yeah, that's really interesting. So I'm curious, just to follow up here, and this is a bit of a loaded question. I'm going to assert that by and large, CROs are not particularly great at running recruitment processes. Even the ones who have bought patient recruitment companies, it's sort of a mixed bag. I would say no one is great at it. Do you have a sense of, like, I don't know why that is? Like, having been on the outsource side, having been on the we built this thing ourselves side, like, I feel like you guys have a decent track record and are pretty good at it. Why is that not more commonplace at the CRO level?
Boy, I don't know, because I don't come from working at CROs. Now, in my previous company, we had a lot of CROs as clients, like IQVIA, like Icon, like PPD, but we never really worked with their recruiting. I do always, in conversations with these individuals, they always were frustrated about recruiting. And I just think that's a general thing across the industry. And I don't know why, Steve. I truly don't.
Right. That's fair. I appreciate and I don't know versus making something up. So, Joel Morse, 10 out of 10 score for integrity. on answering questions. Cool. Let's keep going. All right. A fun one here. Just your last ticketed event. I think going out and touching grass, as the kids say, is pretty fun. So this is not like a conference, but the last thing you went to where you had to pay to get in: movies, concert, live theater, anything where you like purchased admission and went to see something in the real world.
Yeah. So, I had a son, I have a son that was in college in Ithaca, New York. And one of the things that we loved about going up there was to actually go to the state parks and walk the
Hmm.
trails. And so there's an admission fee. It's very inexpensive. I think $10 a car. But basically, that's probably the last thing that we've actually paid for to answer your question. And it got us out into the real world, and lots of great hiking in the gorges and the trails up in the Finger Lakes region of New York.
That's got to be the most bang for your buck in
It's
terms
great.
of dollar to awe and wonder
Yeah. Yeah.
ratio.
Yeah.
$10 to get in the public park, go see some amazing sights of nature. Fantastic. We have nature in Florida, but it is not the same. I don't know many people who are big hikers down here because it's very flat and very hot all the time.
Yeah.
All right, we're going to keep rolling on the wheel. We're making good time. I think we're going to get to go deep dive. Okay. Um, this is another silly one. What is the most boring or embarrassing thing you consider yourself a connoisseur of?
Wow. Because a connoisseur I'm not a connoisseur of much, actually.
So, like a
There.
hobby or something where you're like, I actually know a thing or two about this subject, and everyone else is like, what? You know a lot about grill covers? But it doesn't have to be grill covers.
Yeah, so I grew up in rural New Hampshire on a family farm. So it wasn't our business, but we had, sheep and chickens and cows and turkeys and things like that. And so I'm actually pretty good at managing pets and understanding, what animals need and the things like that. I don't really use it anymore in my life because I live in a suburban region, but that is something that I'm pretty familiar with with livestock. And I think one of our closest family friends was what he called a bovine podiatrist, but that means he trimmed cow hooves. And this is before your time, I think, but there was a TV show called What's My Line? And I remember that he was on What's My Line, and he won because nobody could guess that, he trimmed cow hooves. And so anyway, the whole farming thing I know a little bit about.
That is some awesome lore. The bovine podiatry, I did not see
Yeah.
coming. So you're like the animal whisperer.
Yeah, maybe.
All right. Is there like any part of you that's just like, I want to move out of the suburbs, back to the farm and like just have my flocks and my herds?
Now that got beaten out of me by high school. So anyway, no is the quick answer to that.
All right, fair enough. We are not an animal family. Someone gave us a bearded dragon, and we are like on the internet once a week trying to make sure that we don't kill this thing. And it's terrifying. I don't like the responsibility at all. All right, we are pretty much only serious questions left, so get ready to lock in, Joel.
I don't know.
All right. So again, a long one. This is just for me. When I first met you and when I first got introduced to Curavit, I thought of you guys as mostly a tech company that kind of like supported clinical trials. And now you're just firmly, and even the way you describe yourself is in that CRO category. Did I misunderstand the company when I first met you, or has Curavit's idea of what you actually are kind of changed over the last 6 years?
Well, it's definitely evolved. And I think there's two things. Also, the market evolved. So when we first started talking about, especially decentralized clinical trials, the first question we'd always get from prospects was, well, what's your platform? Because the ecosystem was saturated by the tech companies that were well funded. They could get their message out, and the DCT ecosystem was defined by them. So as a buyer who was trying to understand, a sponsor trying to understand the industry, they, I think, came to the conclusion it needed to be a tech platform that was driving this. So we really had a message that was more tech focused than I think we should have had, frankly, and that we were comfortable with. And and so that our conversations happened during that time and when we first met. And so you clearly you got it right, which is Curavit is describing themselves as a tech platform, but basically we were not. And I think that that always frustrated me because I didn't want to be defined by a tech platform. I wanted to be defined by a specialty CRO, but the conversation kept going back towards tech platform and we couldn't avoid it. What has evolved over the few years is we have been in a stronger position to take a leadership role to define what the industry is and what we are. And so when people ask about our platform, we always answer the client's question. So we answer it in terms of, because we have built our Stratus platform that manages the entire screening process all the way through, enrollment, consent, and then throughout the trial. And we can answer it that way. But the real issue is that our specialty services are around designing and executing DCT or hybrid clinical trials to the most effective way possible. And so I think that the industry has caught up with that. There's some really smart people in this industry, and I think also the tech companies have found their place as well. And so today I think it's a lot easier for us to describe exactly what we do.
Got it. That's really interesting. So it sounds like your DNA and your vision for the company didn't necessarily shift. The way you were describing yourself in the marketplace was a function of what people felt like they needed to hear at the time. Do you think, I don't know, if you were going back, because your answer, you said now we have enough leadership where we can define ourselves. Is that a function of being around for a couple of years? Like if you were talking to someone who was starting out today, would you tell them to kind of frame themselves in terms of what the market wanted to hear? Or is it better to just stake your claim from day one and be like, this is who we are, figure it out?
Well, I think this is an industry that is heavy on show me what you've done. And so I think, as you know, it's really hard to start out with a clean slate because then you need to get some real forward thinkers to sign up with you and then to, trust you. And I think we had that because of our tenure in the industry that helped us get that start. But I think that, if you were just starting out, you would, I think, go back to why would I be important to you? And that was some of the best advice I ever got from an advisor, which is be important to somebody. So if you're just starting out, what problem are you solving for the person that you are trying to solve it for? So if you're going to sponsors, what are the things that you're trying to solve, and that should be important enough where that sponsor looks at you as somebody new entrant and says that is something that has not been fulfilled yet, and it's a big need, and finally somebody's talking about it. I will trust you, and together we'll execute what you're trying to do. And maybe that's not super clear, but the issue is
I think it's
hard,
really good.
Yeah.
It's really good, and I love that. Why are you important? Our founder spent 2 semesters at Stanford, and Y Combinator gave us $10 million. That's why we're important. Is that a good answer?
Well, I've heard that story. There's a lot of stories out there, and what I've heard a lot in the last couple of years. And if you were at Scope last year, you definitely heard a lot of people say, "Hey, I have AI recruitment," and I'm like, okay, what is that? And then why is that? And why is that helpful to the industry, or to, what problem are you solving? And it was really hard for, I think, people to answer that. So that's a problem. If it's hard for you to answer, like, what problem are you solving? Why is that different? And how are you doing it differently? Then I think people should readjust. And look, we've all had to readjust over the years. So.
Yeah, for sure. All right. Thank you so much. We're
getting down
forging ahead.
Yeah.
All right. So Lindus called itself the Anti-CRO. Is acquiring the Anti-CRO the most CRO thing?
That's a great question. So Lindus, like I said earlier, I've known the founders of Lindus since they founded the company, and we got to know each other because I think we had very similar missions, and we're also competitors, and we wanted to stay close and understand what each other's doing. And they, like us, always worked on trying to understand the right positioning. And for a while, they landed on the anti-CRO because their mission was that we will do things differently, and the inference was better than your common CRO. I would say that I was never a fan of that. That's just not my DNA to be negative. And I come from a deeper background in pharma in the CRO world from my other company. And there's a lot of good out there in the CROs. And so basically, even Lindus was pulling back from that and they were changing it to the innovation CRO. So they also got feedback that that wasn't resonating. This is not an industry like, Meta or back when it was Facebook said, move fast and break things, and that drives innovation, and it does for their industry. That's not this industry. This industry is move cautiously, focus on safety, and innovate appropriately. And I think that Lindus was getting that message loud and clear. We've had that for a while, so that's nothing that we will be transferring over in the acquisition.
Got it. Yeah, that makes sense. I will say, like, I really appreciated that message. The anti, like, it resonates with me, but I tend to, I tend to be a little bit nonconformist. So that's fair. Is there anything like in their philosophy of like, hey, this was broken and the anti-CRO was really just a cover to say we want to fix this element of CRO operations? Is there anything that they got right that you're hoping doesn't disappear as you fold them in?
Boy, they got a lot of things right. And the biggest part that they got right is the people that they hired. Like, so part of the acquisition, we took
So diplomatic.
no, but it's really true. Like we'll probably take on over 40 people at one. Well, we've taken on about 40 people, maybe 50 on one fell swoop. And I am like, if we had to go out and hire those people, that 20% are probably going to fall out because they're no good or whatever, or they just mismatch. We are so lucky to be working with that team, and they got that right. Like, they have a really big culture, and I think that's what really tugged at the co-founders, because I had a lot of conversations with them about this, which is making the message to the employees, and they were literally in tears because they had built such a culture and hired some of the best, and we were fortunate enough to inherit that, and we're proud that these people want to come work at the what we're now calling the one Curavit, but they got a lot of that right. They got a lot of, client engagement stuff right. And, yeah, so, and also we have very similar processes. Like, a lot of the clients, they're like, well, nothing's really changing because basically everything that they were doing, we were doing. It's very similar processes, ecosystem, et cetera. So we also thought we were doing a lot right. And, I think given that they're doing literally the same processes and having successful clients, I think we both are onto something as it relates to that.
Right on. In the press release, and you mentioned this earlier in the call, it kind of touched on, stitching together U.S. and European operations for decentralized hybrid and then site-based studies. And I think that like stood out to me because I didn't necessarily have you guys associated with like tons of site-based studies. Are they in the same operational model as like a normal CRO, or what are you doing with sites, or is it any different, or is it just kind of we pick some sites and we send studies to them?
No, so when we get a protocol that we take a look at, and I'll give you an example. So we had a Polish-based device company come to us and said, hey, we are building this device. It's meant to be used by pregnant women, week 27 beyond, in the home, because we don't want them to keep coming to the clinic. And we took a look at the protocol. We looked at what they're trying to do, and we said, this is actually a site-based trial for all of these reasons. And everybody agreed, the lawyers and statisticians and everybody. And so the protocol was finalized to be a site-based trial, and then they wanted to be run in the U.S. And so we work very closely with a lot of the national sites
Okay.
And that's one that's been great with the PEs have been rolling up some sites. So you can go to 1 or 2 contacts and they can give you 7 to 11 sites with one contract. And so basically we are a CRO. We then screen the site. We do the site investigator meetings. We have CRAs that go to the site and, conduct their visits, all of that. So think of us as a site-based CRO with a heavy execution, though, on hybrid or decentralized clinical trials.
Got it. Okay. That's really helpful and cool example. And I hope that the Polish pregnancy device went well.
The CSR just got approved today, and it was a
Wow.
wild success. Wild success.
That's amazing. All right. So we've been circling around this, and I know so many people have talked about it. I'm just curious, like from your chair, there was so much talk about like, every study is going to be fully remote, interventional trials from your living room in Bozeman, Montana. I think that died down, obviously, and we're kind of in the post-hype phase. But how would you characterize sponsor demand for it says truly remote trial, like a fully remote trial today?
I think sponsors have moved past the definition of, hey, should it be DCT, hybrid, or whatever. I think the sponsors that we're talking to are saying, what is the best trial for the outcome that we're trying to achieve? And the best trial is defined by, quality of data, time, price, budget, impact on participant. So basically, I think we're in a lot more thoughtful conversations about what should the trial design be, versus, hey, how can I make nobody 2 or 3 years ago, a lot of sponsors are saying, how can I make this decentralized? Today, we don't have those conversations. We have conversations on what is your input on optimizing my trial protocol to give me the best outcomes. And again, best defined by budget and time and safety and, et cetera. So
I think like a lot of those conversations that like where I touched it, was mostly because my background just recruitment mostly was around patient access. Is that like leading the charge when you're talking about best in terms of some of these applications? Like, hey, we can widen the aperture here and get in front of a lot more people if we can add decentralized element XYZ without sacrificing quality? Or is patient access just one of like a million things that you're talking about?
now it's really big, Steve. And you hit the nail on the head, because also patient access means that we as an entity can actually control the numbers. So we will sign up for timelines and budgets and deliverables if we can control the process of bringing people in. And so I think that's really appealing. And then you overlay onto that how you're going to get specific demographics, whether that be skin tone or financial income or geography, et cetera. And so if you're able to do at least the recruiting part of it, more in a decentralized, ubiquitous way where geography isn't an anchor, you can really bring a lot of value to the sponsor. And that's what gets sponsors really interested. So, we're kicking off probably 4 new decentralized trials right now, and the sponsors are just super happy with our ability to recruit the right demographic in the right amount of time for the right budget. So,
that's awesome. Super, super glad to hear it. I've been rooting for you guys for years, and it's exciting to see things coming to fruition.
I appreciate it. I still remember our first conversation. I looked at a press release that you did, and I said, who are these guys? I got to talk to them. And I called you. So
at least 6 years ago, press releases worked, ladies and gentlemen. All right, this is the last one. I ask everyone this question just because I'm trying to get a sense of where people are at. So this is not necessarily Curavit, like what are your processes like? This is you, Joel. Like, what are you opening up, interacting with on an average day from an AI perspective? Like, is it impacting your workflow at all, and how so?
Significantly, it's like I have a junior analyst working for me.
Okay.
So because I can say, hey, here's an MSA. So as an example, we acquired Lindus and we acquired some MSAs, and a client would say, "Hey, I don't want to sign a new MSA. So can you take the Lindus MSA as an example?" And so I can, again, behind our firewalls, look at, hey, is that MSA completely, where is it different from ours and what's my risk? And so I'll do something like that. I will have it help me write. I will have it help me think. And so what I absolutely never do is take the writing and just copy paste it. What I'm looking to do is get ideas, and I might say, I'm thinking about writing it this way. Can you write maybe 3 different sentences? Then I'll try to pick one and do this. So I use it extensively, just to help me think, to help me bounce ideas. We all work remotely, so it's hard sometimes to bounce ideas off people, and it's a great way to do that. But there's tremendous limitations that you have to be careful with.
Right on. We did it. We exhausted the wheel, and it's like 30 minutes and 7 seconds. That's perfect. Joel, thank you so much. Congratulations on the acquisition and the growth and the success. I'm really stoked for you and the team. I know you got a lot of cool people there. So yeah, just thanks so much for joining, and I will see you at the next conference, hopefully.
I hope so. Thanks, Steve.
All right. Cheers. Thanks for listening to 30 Minutes Randomized. If you enjoyed the show, please feel free to like, subscribe, review, or share it with a friend. Until next time, I'm your host, Steve Wimmer, reminding you to stay random.